Welcome to the MTRAC 2 training video, Managing Immunizations, Viewing and Editing Immunization Records. Objectives. The objectives of this video are to demonstrate how to view and edit client immunization records in the MTRAC 2 registry. Users can view any client and their immunization history that has consented to participate in MTRAC 2. The fastest way to view a client immunization record is to click the Manage Immunization link in the Application menu panel and the Client search screen will display. On the Client search screen, use one of the three search options to perform a client search. For our example, let's use the Quick Search option. Let's search using the MTRAC 2 ID 208105748. Click the Find button. Because we entered the correct MTRAC 2 ID, the client's immunization record displays immediately. At the top of the client immunization record is the Client Information section. This section should be used to verify the correct client record was opened and displays the following information: the system-generated MTRAC 2 ID that is automatically assigned to each client, the client's name, date of birth, and gender, the tracking schedule assigned to the client by the user's organization. This defaults to the ACIP schedule but can be changed at an organizational level. The client ID, or the unique client identifier assigned to the client by the user's organization. The client's address and phone number, the comments that were selected and added to the client's record, and the client's current age in years, months, and days. The client notes represents the total number of notes logged on the client's record. In this example, Brian Blue has a total of 4 notes. Click the blue hyperlink to view the existing notes or to add a note to the client's record. When the Client Notes screen opens, the existing notes display at the bottom of the screen. Use the Create New Note section to enter a new note on the client's record. Then click the Save Note button. The following message displays: Note successfully saved. Close the browser window to return to MTRAC 2. Next, let's review the immunization record. This section lists all immunizations received by the client that have been logged or uploaded into the MTRAC 2 registry. The immunization table includes the following information: vaccine group, the vaccine group for the immunization received, date administered, the date the vaccine was administered. Click the Date hyperlink to view the Explanation of Dose Status pop-up window for that particular immunization. The pop-up window displays the tracking schedule rules for the selected vaccine series. Close the pop-up window to return to MTRAC 2. Series: a sequence number along with the total number of doses within the immunization series displays for a valid immunization. An example is 1 of 4. Vaccine trade name: the name of the vaccine provided by the manufacturer. Dose: the dose magnitude reflects how many or how much of a dose was administered to the client. For example, 2 or 3 doses, or a full or half dose. If the field is blank, it's a historical immunization. Owned: indicates whether the immunization was entered by the user's organization or by another organization. A blank in this field means the user's organization entered the vaccine record. A no means the record was entered by another organization. Click on the hyperlink to view the name and contact information of the organization that entered the record in a pop-up window. The pop-up window provides the organization's name, address, contact name, and phone number. Close the window to return to MTRAC 2. Reaction: displays an indication of whether a reaction occurred. A blank means no reaction was entered into MTRAC 2 for that vaccine. A yes means a reaction was recorded. Click the hyperlink to open a pop-up window describing the reaction. The pop-up window lists all reactions that occurred as a result of the administered immunization. Close the window to return to MTRAC 2. Historical: indicates whether the immunization record was entered as a historical immunization. A historical immunization was not administered by the user's organization, but the user's organization did add the information to the MTRAC 2 registry. A yes in this field indicates the record was entered as a historical immunization. Disaster indicates whether the vaccine was administered during a disaster event. A yes in this column means a disaster-related immunization was administered during a disaster event. Edit displays a clickable icon that navigates the user to the Edit Immunization screen. Editing an immunization will be discussed later in the video. At the bottom of the screen is the vaccines recommended by the Selected Tracking Schedule section. This section displays the recommended vaccines and the corresponding vaccination dates based on the selected tracking schedule for the client. This section displays the following information. Select. Use the Select checkboxes to select any of the recommended vaccines to quickly add them to the client's record. The Select checkbox does not display if the vaccine is no longer needed or recommended. Vaccine Group. The vaccine group name for the recommended vaccine. Click the vaccine group name to view the explanation of dose status pop-up window. The pop-up window displays the tracking schedule rules for the selected vaccine series. Close the window to return to MTRAK 2. Vaccine. The vaccine name. Earliest date. The earliest date the client can receive the recommended vaccine. Recommended date. The date the client is recommended to receive the vaccine. Past due date. The date the client is past due to receive the recommended vaccine. Now that we have reviewed the main sections of the immunization screen, let's review the command buttons. There are 5 command buttons available on this screen. Add new immunizations. Click this button to add a new, non-scheduled immunization to the client's immunization record. Add historical IMs. Click this button to add a historical immunization to the client's immunization record. Note: for more details on how to add immunizations, please view the MTRAK 2 training video, Adding Immunizations. Edit Client. Click this button to quickly navigate to the View/Edit Client Record screen. Reports. Click this button to navigate to the Reports Available for Client screen to generate and print reports for the selected client. This screen gives the user access to the client's official immunization record and their immunization needed report. Selecting a report hyperlink opens the report in a separate browser window. Click Cancel to return to the client's immunization record. Print Official Immunization Record. Click this button to view and print the client's official immunization record in a separate browser window. Click OK to acknowledge the client or guardian has consented to print the official immunization record. The client's official immunization record displays. Note: the format of the official immunization record will change to meet the requirements of the Department of State Health Services. Close the browser window to return to MTRAK 2. Now that we have completed the review of the immunization history screen, let's learn how to view immunization details and edit an immunization. Reminder: users can only edit immunization details if the vaccine was administered by their organization. This is represented by a blank in the Owned column. Click the Edit icon to open the Edit Immunization screen. On the Edit Immunization screen, white fields are editable. The manufacturer, vaccine lot number, date administered, and vaccine eligibility fields are required and must always remain populated. The Reactions to Immunizations section at the bottom of the screen should be used to note reactions to the vaccine. This section can be updated by any user regardless if the immunization is owned. If edits are made, click the Save button to update the record and return to the client's immunization record. Users can also delete an immunization if the vaccine is owned by their organization by clicking the Delete button. When the pop-up message displays, click OK to delete the immunization. Users are returned to the immunization history and the client's record is updated. Note: the MTRAK 2 customer support team can also delete immunizations. For more detailed information regarding any of these topics, see the online user manual located on the Related Links tab. Please review the other MTRAK 2 videos at mtrak.dshs.texas.gov at your convenience.